Hi, I'm Rakesh Kamal. I'm co-founder and production lead at Suno India. Suno India is a multilingual, multi-generational podcast platform. We are solely dedicated to producing audio stories on issues that matter. Suno India shines a spotlight on underrepresented and underreported stories using audio as a medium. We set our own agenda and we are editorially independent. And we are today really happy to organize this workshop in collaboration with Center for Mental Health Law and Policy and Suicide Prevention and Implementation Research Initiative, SPIRIT. We have Dr. Soumitra Patare, Arjun Kapoor, Jasmine Thala, and Tanmay Goswami talking today. So that's all from me. Over to you, Dr. Soumitra.
Thank you. Thank you so much. And thank you to everyone who's joined. I'm really pleased to know that there's at least so many people in the media who are interested in looking at suicide reporting. The way we are going to do it is I'm going to go off first and I'm going to be followed by Jasmine and then Arjun. So before we start off, I'm also, Jasmine is controlling the slides. So I'm going to just keep on saying to Jasmine, next slide, please, and then it kind of moves on. So that's how it is. Can we have the next slide, please, Jasmine?
I just actually wanted to clarify if people have questions, when can they ask questions? So any housekeeping rules that we need to follow?
Yes.
Yeah, go ahead.
Yeah, few housekeeping rules. I've already shared it with all the participants over email, but just keep your microphone on mute and video off. If you have any questions, you can write in the chat box. At the end of it, we will take up all the questions and answer them. So yeah, this video will also be available on YouTube for people to see it later. Thank you.
Thank you. So I'm just going to move to the next slide.
Just a trigger warning for everybody. Sometimes the images and language that is being talked about in this workshop might be triggering for people. If that is so, please feel free to leave the workshop if you're feeling depressed or distressed, or if something is triggering you. There's also the phone number here, which you might want to jot down in case you needed to call someone because you are very distressed. This is Asra Foundation, which is a suicide prevention helpline, which is open 24/7. So I'm going to leave this slide for about another 5 or 10 seconds so that you can write down that telephone number just in case you needed it later on and you need to leave. It's absolutely fine if you feel that you need to leave. Yeah. Can I have the next slide, please? So why is it important to talk about suicides in India particularly? India accounts for about a third of the suicides that happen in the world every year. And considering that we are only 1/6 or 1/7 of the humanity, that really means that our number of suicides are twice as much as what the rest of the world has. And so if we are going to reduce suicides in the world, then basically suicides in India need to go down. And this is one of the attempts at trying to reduce suicides. And I hope you'll be convinced by the end of this presentation why, as media people, you will be able to make a difference in this issue. Can I have the next slide, please? Some of you might already know this suicide data, but I think it's important to reiterate this for people who are not aware of. If you look at India's suicide data from 1990 to 2016, so over a period of 25 years, as a proportion of global suicides for women, India's women were 25% of suicides in 1990, and that went up to 36.6%. So more than a third of women who die of suicides in across the world happen to be Indian women. And in terms of men, that proportion went up from 18.7% to about 24%. So what was 1 in 5 or 1 in 6 has now become a 1 in 4. So 1 out of 4 men who die of suicide in across the world happens to be an Indian man, and 1 out of 3 women who die of suicide across the world happens to be women. So if we want to do something about suicides in terms of the world, then this is where the action needs to happen in India. Why is that important? You probably have all heard about the Sustainable Development Goals, SDGs, and SDG 3, which is related to health and well-being. One of the indicators for SDG 3 is suicide rate. And the target for 2030 is a one-third reduction in suicide rate across the world. Now, it doesn't take a lot of maths to understand that if you want a one-third rate of reduction of suicides across the world, and one-third of the suicides are happening in India, then the largest proportion of suicides are in India. You need to see reduction in India's suicide rates. And a recent paper in the Lancet actually estimated that India has a 0% chance of meeting that target. So if the world needs to meet a target of 33% reduction, and if India doesn't contribute zero, the rest of the world will have to reduce their suicides by like 50 to 60% to bring suicide numbers down. So you see the scale of the problem and where the problem is. It's India. The other important metric about India and suicides is among young women aged 18 to 39, suicide is the #1 cause of death. You might all be surprised to know that it has displaced maternal mortality. So maternal mortality, this is women of what are called childbearing age, 18 to 39. Women do not die of maternal mortality as frequently as suicide in India. And for young men in the same age group, it is the second commonest cause of death after road traffic accidents. So you see, suicide is an issue for men as well as women in terms of the mortality that it causes. The third important thing that you need to understand about Indian suicides is that, in Europe, the sex ratio for suicides, which is how many people who die by suicide, how many are men and how many are women, the sex ratio is 4:1, which means that there are 4 times as many men dying of suicide as there are women. Whereas in Southeast Asia, and particularly in India, that ratio is anywhere from 1.5:1. What does 1.5:1 mean really is 3:2. That is, for 3 men who die of suicide, you have 2 women who die of suicide. And what it really does mean then that Indian women are dying more frequently by suicide than, say, other women across the world. And that is what the last bullet says, that the suicide death rate in women in India is about twice as much as the global average. And finally, one last point that I wanted you to keep in mind here is that, in India, the peak of suicides is actually in young people, which is aged 18 to 39, which is not unusual. We have a young population. Whereas if you look at other countries, especially in the West, the peak of suicides might be in ages of 50 to 60 to 70. So they are older suicides, whereas in India, they are younger suicides. So all the more reason why we should be doing something about suicides. And suicides are the great unspoken, in a sense, in our community. We don't really talk about them. And we are hoping that by getting you to talk about it in a more sensitive manner, we will actually be able to raise conversations around suicide in our country. Jasmine, can I have the next slide, please? The other important thing about India's suicides, and I don't know if you can see my arrow, but my mouse pointer, but there is also a geographical gradient in suicides. I hope this slide is very clear to you, but let me try and make sense of it for you. What do I mean by geographical gradient? The color codes are actually rates of suicide, and the yellow is the highest rates of suicide, whereas this purple, Bihar, is the lowest rates of suicide. And you'll see that there is a south to north gradient, so that the rates of suicide are highest in the south, and as you go further, as you go up north, they start to get less. There's also a economic gradient, which happens to be also a south to north gradient, which is that the richer states like Kerala and Tamil Nadu have much higher suicide rates. The states which are middling from there, which is Gujarat, Maharashtra, have middle kind of rates. And then if you go to the poorer states, which is up here, which is the brown and the purple, which is Uttar Pradesh and Bihar, they have among the lowest suicide rates. So there is a kind of gradient, which is economic gradient as well as a geographical gradient in suicide. So again, if you were trying to do suicide prevention, then these states in green and yellow are the ones where you're getting the maximum number of suicides, and you want to really concentrate a lot of attention on those states to try and get their suicides to come down. And one final metric that I wanted to leave you with is to remember that there was a million death study. What was a million death? They just, the Registrar General of India collaborated with some researchers, and they looked at 1 million deaths which had happened, and they went off and did some autopsies, verbal autopsies on those deaths to try and ascertain the cause of death. And in that million death study, they also ascertained suicides. And what they found in the million death study was that suicide deaths in rural areas are about twice as much as suicide deaths in the cities. So, you know, there is a story here, which is that the richer states, the southern states, and the rural areas, and its women, and its young people. And that's really the takeaway from these two slides that I want you to remember, that that's the kind of population where suicides are happening maximally. Jasmine, can I have the next slide? Turning to what are the means of suicide. Again, this is, why am I telling you this? Because this is very different from the rest of the world. In India, almost half of the suicides are by hanging. So in the latest NCRB report, 51% of suicides were hanging, and the next commonest cause was poisons, which is largely insecticides and pesticides. And that contributed to about 26.7% of all deaths. So 1 out of 2 deaths are by hanging, and 1 out of 4 deaths are by pesticides, which means 3 out of 4 deaths are contributed by just these 2 causes or these 2 methods of how people die of suicide. One more important issue to remember is that, you know, you must have seen conversations on social media that every time there's an article on suicide or somebody dies of suicide, then there's always this thing about mental health and, oh, what is happening? Are we treating depression properly? Are we not treating depression properly? That does not really tell the Indian suicide story. In high-income countries, 90%, 80 to 90%, depending on which country you're talking about, of people who will die by suicide do have a mental illness. Okay, will have some mental illness, mostly depression. But in India, that is only about 50% of suicides. So only half of the suicides that you have in India are actually because there is a concomitant mental illness. So if you do not take that into account, then you can actually go very wrong. So suicide prevention efforts in the country need to also take these facts into account, and that India's suicide profile is quite very different to the suicide profile of the rest of the world. Jasmine, can I have the next slide, please? So what are these individual factors? And here's a list of these individual factors. I'm going to talk about one specific one here because it actually relates very much to India. And not that the others are not important, but the whole issue around harmful use of alcohol. In about 1/3 of suicides, especially among men, there is either a history of alcohol consumption before the suicide, or there is a history of harmful use of alcohol or an alcohol use disorder. So alcohol and suicide are actually very linked. So if you want to address suicide, we also need to address alcohol. So the alcohol policy is something that needs to be addressed not only from an addiction perspective, but also from a suicide perspective. And in fact, one of the most robust indicators of suicide is actually a history of a previous suicide attempt. You know, I mean, that might sound very odd to you, or very obvious to you that, yeah, somebody who attempted suicide before might actually die of suicide later. But that seems to be the most robust indicator, and it's probably the highest risk factor. So somebody who's attempted suicide is probably someone who you want to direct your suicide prevention interventions to. Can I get you to move to the next slide? So what I want you to do is to move away a little bit from these individual factors which we talked about earlier, but to actually start looking at other factors. There are interpersonal factors where, again, for India, one of the most important interpersonal factor is domestic violence. 1/3 of women who die of suicide in our country have a history of having survived domestic violence. And that is a huge, again, another huge intervention that can be required. Systemic factors such as economic crisis, unemployment, job losses are very important, not only for urban populations, but also for rural populations. The data from other countries like in Europe after the 2008 crisis, what we know is that suicide rates actually did go up. So after an economic crisis, suicide rates go up. But interestingly, after an economic crisis, alcohol use rates also go up. And so you can see how they both kind of feed off each other. So increasing suicide rates by themselves, increasing alcohol rates, which also then lead into the suicide rates. And clearly then there are some of these other community factors which particularly that I wanted to kind of bring up in the current situation are two particular ones, that the issue around discrimination around caste and gender and sexuality, that is a factor which you know, it's in the news, you know about it, and that is known to be predisposing people to suicide, and inappropriate media reporting, and we'll talk about that today much more. And finally, you know, dislocation due to migration is also linked with suicides. So, you know, you have a situation here where people, especially in the fact that, given the fact that people have now moved back home because of the whole migrant worker crisis that you had, what effect that is going to have on our suicides in the country as we go ahead is something that we really hope we are wrong, that these things will make a difference, but it's something we need to be aware of given the current situation. Can I get the next slide, please? So that, what is the rationale for this workshop? Why? So this is all very fine. You say all these are things. What am I going to do? I'm a journalist. I report suicide stories. Why should I be really concerned about it? Why does it matter for me to do anything which will make a difference? And what you find is this is a excerpt from a paper, and I'll tell you about that paper. But what it talks about is suicide reporting in India. And it says a daily diet of short, explicit, repetitive, simplistic, and potentially harmful suicide-related news. And that is from a research paper which is hardly a year and a half old. And I'll tell you about the paper on the next slide if I can have that, please. You know, this is a study that was done by one of our collaborators on our project, Lakshmi Vijaykumar and some researchers from Australia, and they looked at 9 English language newspapers in Tamil Nadu over a period of time. And they looked at around 1,700 articles. And what you get is that vast majority of the articles focused on reporting the incident as opposed to doing any, you know, having a discussion about suicide prevention. The articles did little to educate public about the issue of suicide. And there were a lot of harmful reporting practices. For example, a detailed suicide method was reported in almost half of the articles. And hardly 2.5% of the articles gave some contact details for a suicide support service. So clearly reporting suicides in India is a problem. You would probably still say, fine, reporting is a problem. Why should I be concerned about it? And how does that impact suicide? So can I get to the next slide? So, you know, why does it matter? Here are studies. This is a study, and I think Tanmay is going to talk more about it. So I won't labor on with it. But this is something from Austria, and what they did was they were having a lot of suicides on the underground transport. So the transport company, in association with the newspapers, you know, they put a moratorium on reporting subway suicides, meaning underground suicides. And they said, we will not report that these suicides had happened on the underground. And what did you see is that in the year after this was introduced, there was a significant reduction of suicides and an immediate decrease of approximately 10 subway suicides. So, you know, changing reporting has an immediate as well as a long-term effect on suicides. So what you do as a journalist and how you report the stories and which stories you report can actually make a difference to somebody else's life, whether they live or they die. And so, you reporting these stories in a particular way has a huge impact. I'll give you another example, which is much more recent, if I can have the next slide. This is, all of you know, Robin Williams. Robin Williams died in 2014. And this is again a study from after Robin Williams' death. What they found was that in the 6 months after Robin Williams' death, there was a 32 or 33% increase in the number of suffocation suicides, compared with only a 3.1% increase in the number of suicides from all other methods. So what happens is, reporting the methods of suicide and the method that has been used by a celebrity especially is known to trigger what are called copycat suicides, and using the same method. And recently we've seen the same thing after the death of a quite well-known film star. There have been some copycat suicides using the same method. And so that is the reason why many of us keep on telling you as journalists, please do not report the method of dying. Do not report the place where they died, because these things kind of make a difference. So I hope, in a sense, you'll realize the important role that media can play in actually reducing suicides in India, and the reason why, the importance of why India needs to reduce its suicides along with the rest of the world, and why, if this world is going to meet the SDG targets, then India is a focus. And if India is a focus, you as media are also the focus where work should be happening. So I'm going to end now with another slide, which is a short film, I think. If I, I think I've said this. Can I move to the next slide? Yeah, and this is a short
Responsible
film.
media reporting on suicide is a key.
Jasmine, go ahead, please.
Do you want to say something, or should I just play it?
No, I think you should just play it, because it says everything that I want to say.
Sure.
Key component of many national suicide prevention strategies, and also recommended by the WHO. At the same time, the combined evidence of an increase in suicides after media reporting in news and information media is limited. This is why we conducted this systematic review and meta-analysis. We included all studies that were available on the topic, which had suicide as the outcome, were about non-fictional suicide reporting, had a follow-up time of up to 2 months after the suicide reporting, and covered suicide reporting in news and information media. Further, we only included designs which had a pre-after design or time series analysis design. In total, we identified 31 studies. 20 of these studies had a moderate quality, and those were included in the primary analysis. We found that after the reporting of a celebrity death by suicide, there was an increase in relative risk of 18%, which is quite a considerable, meaningful increase in suicide rates, considering, for example, that the global financial crisis of 2008-2009 was associated with a 6% increase in suicides. At the same time, the increase in the same method as the method used by the celebrity was even 30%. And finally, for general suicide reporting, which includes any type of suicide reporting, it might include even articles on suicide prevention, this type of reporting was not associated with suicides. In total, we hope that these findings clearly strengthen the recommendation to use media recommendations for suicide reporting. These recommendations have been implemented in many countries, but in some countries, particularly in Southeastern Asia, but also sometimes in Europe and in the United States, there is still sensationalist coverage of suicides, and we know now that this has to be prevented, and media guidelines for suicide reporting are the most available means to do so.
So that is what I was going to end with. This is the last thing. What we are now, this is not my slide, isn't it? This is, I think, Tanmay, is that you now after me? Yes,
Yes,
Tanmay is
that's
nodding his head. Yeah, so I'm going to stop here and hand over to Tanmay, but I hope I've been able to convince you of the important role that you as media professionals play in reducing suicides, and especially as that video said, is reducing suicides in Southeast Asia, which is a hub of a large number of suicides across the world. Over to you, Tanmay. Thank you so much.
Yeah, hi. Thank you, Dr. Patari, and thanks everybody for joining. So good to see all these people on a Friday evening. I think I'll just zoom out a little bit. The content of this slide is self-explanatory, but as the sole representative of the journalism community on this panel, I just want to share a small story that will illustrate the very fraught relationship that I think reporters have with suicide stories. And it is this. I was having a conversation with a fairly senior editor a couple of years ago, and I was trying to basically talk to him about all of these issues about why ethical reporting on suicides matters and why suicide should not be treated as just another news break, why there is need for sensitivity, etc. And the question that I kept getting from this gentleman was, but why? It is so long as we don't misrepresent anything. Our job is to present the news in its totality. We are fact gatherers, and so we should basically present the entire suite of facts at our disposal. That's our job. It's hard to argue with that kind of reasoning, because that's the classical model of journalism, isn't it? That we are news gatherers, and so long as we don't misrepresent any facts, we are doing our job. And ultimately, after arguing with this person or reasoning with this person for 20 minutes or so, I gave up. That's when I really started educating myself on how to have these conversations intelligently. And after that, every time an editor asks me this question, I ask them in return, whose interest are you serving by presenting one more nugget of information, one more titillating story, one more piece of speculation? Whose interest are you serving? And more often than not, I don't get a response. The conversation just ends there, because they very swiftly realize that nobody's interest is really served. In fact, a lot of people's interests are harmed in this mindless pursuit of that one extra little nugget of information. So, and that has sort of then, that has become a lightning rod for me as a mental health journalist. Any piece of information that does not serve somebody's interest but could stand to harm them is something that should be cut straight out. That's the rule, the rubric that I try and follow. I have often wrestled with, in my early days when I started learning about this area of media responsibility from the likes of Dr. Patari, I often used to wrestle with them. And I often used to wonder, do these people want us to stop writing about suicides altogether? Do they want to censor us? Is that the goal? And censorship is a word that makes us see red. And over time, I've realized that it is not censorship that is being advocated. Responsibility is unfortunately very often equated with censorship, but the two things are very, very different. And basically, what I've realized is that suicide prevention advocates want roughly 5 things from us. Don't sensationalize, don't describe the method, don't breach the privacy of the deceased and their family, don't speculate about mental illness, don't legitimize suicides as an acceptable way out of certain difficult life situations. This pretty much covers everything that experts find objectionable in suicide reporting. They do not want censorship, they do not want to take away our freedom to write about suicides or to cover suicide news. Jasmine, if you could move on to the next slide. I want to give you an example of something that we've come very, very far from, actually. This is from the 18th century. The Sorrows of Young Werther was a novel written by the German novelist Goethe, and it's about a young man, a very sensitive young man who goes through the trials and tribulations of life, can't take it, kills himself by putting a bullet in his head. And after the book was published, there was a surge in suicides, and Goethe's novel was considered responsible for it. And a very nifty term was created called the Werther effect, which is used to describe the enormous power that popular culture, literature, etc., the written word has over the human mind. We've thankfully come far away from, quite far from making such aspersions about everything to do with suicides. We'll move on to the next slide. Stay with that example of Goethe, and we'll come back to that. Having said that, time and again, there are so many examples of the impact of the written word. After Marilyn Monroe's suicide, and this is probably the most dissected example. In August 1962, there were an additional 303 suicides after Monroe's death was written about extensively, covered extensively in the media. And research in the US and Canada has also shown that media reports that disclose the method, give away too many details, and make it seem as if suicide is inevitable in certain situations could cause a significant uptick in suicides. The next slide, please. So the question is, shall we stop writing about suicides altogether? No. Suicide is by now a major theme in literature, philosophy, movies. Nobody minds that. You don't see processions being taken out protesting any of that. So we have come a long way from the persecution of Goethe. Media has the freedom. We all have the freedom to report on suicides, but responsibly. We will keep repeating this word a lot during this workshop. And that's simply because the reach of the mass media, as we know only too well, cannot be compared with fiction or non-fiction. It's massive. And responsible reporting on suicides, it's not just a moral or philosophical issue. And I think this is a very important point to underline, because we have to understand that this is not a subjective call based on one's conscience. It actually literally can save thousands of lives. And here's an example of that. The research in the US and Canada that I cited in the previous slide, one of the researchers associated with that found that there was a 1 to 2% variance in suicides due to media reporting. And if reported properly, about 8,000 to 16,000 deaths could be prevented just by responsible reporting. Now, that's a massive, massive number by any matrix. So every time I find myself wondering whether I am getting dangerously close to self-censorship, or what is the point? Is this just a subjective moral / philosophical call? I always remind myself that there are real lives that one can save by being a little careful. The next slide. Yeah, I think that's about it from me for now, and I'll come back later. Any questions, please feel free to DM.
Okay, thank you, Tanmoy. Jasmine, is it okay if I continue?
Yes, please go.
Okay, great. Okay, so the idea of doing this workshop was also not to kind of overload all of you with a lot of information and a bunch of inputs. We also wanted to make this interactive, and we really thought that the most productive and efficient use of this workshop would be to kind of get you involved in as well. So what we've done over the next about 40 minutes is we've sort of designed 4 exercises, and we'd like you to have a look at where we basically going to be showing you a bunch of reports, and we would like you to identify both best practices and practices which are not advisable or which don't comply with suicide reporting guidelines. And so the way that we're going to go about this is basically I will first put out a sample news report. Jasmine, could you put on the next slide, please? Great. So we will put out a screenshot of a published article which reports on a particular suicide, and we'd like to give you 2 minutes to have a look at this, and then to put down 3 aspects of the article according to you that sensitively report suicides. And we'd like you to do this in the chat box, because if you all speak at the same time, then that's just going to run into a lot of trouble and be difficult managing it. So have a look at the screenshot, take 2 minutes, and then please put in your inputs and your answers in the chat box, and then we will come to the discussion after that. Just to note, in case you've already identified some of these aspects, you can start putting them in the chat box. You don't need to wait. It'd be great if you can start putting them down so that we can all read them. Okay, I'm going to give another 30 seconds, and then we can start discussing the article. Okay, so I'm just having a look at some of your responses, and I'm going to quickly go through them for the benefit of everybody. At the outset, I'd just like to say these are some fantastic responses, and it really goes to show that this is a really well-aware sort of lot of participants. So we have okay, so just to go through some of the responses, Medical Macaroni says that the article says died by suicide. It talks about the larger debate and gives in guidelines. Holy Campbell, you also say the same, that the article uses dies by suicide rather than committed suicide. Numbers for emergency services have been also provided. Malika, you've mentioned that the article doesn't mention method of suicide. Fantastic. Nagarjuna, a very important point, committed is no more valid under the new law where suicide is decriminalized. Menaka, you also raise a very important point about how the article talks about the need to reach out for support and how talking helps, how suicide is not inevitable as it is sometimes made out to be. Again, Guna, you raised the point about dies by suicide and the larger debate. Savri, you've mentioned that this encourages people in distress situations to reach out. Priya, you mentioned that the helpline has been provided right at the beginning of the article. Shobi, you've also mentioned the same point about the word commit not being used, and very important, the article doesn't describe the method of suicide. Yeah, I think that's really sort of the rest of you have all sort of covered these points some way or the other. I must say that these are fantastic responses. Jasmine, if you could move on to the next slide. Right, so like all of you have said, so what we've done over here is we've tried to highlight some of the good aspects or the best practices in this article. And the blue box essentially has the list of the best practices. So as you can see, most of you have identified this, that the article uses the phrase dies by suicide and doesn't use the word committed suicide. I think this is a really important point, because it really does point to the use of language when you are talking about suicide. And this is something that we will discuss subsequently. And as Nagarjuna also pointed out, it's important to remember that suicide has been decriminalized. Section 115 of the Mental Health Care Act very clearly says that the presumption, in case of a person attempting suicide, the presumption is that such person has attempted it because they were under severe stress. And hence, Section 309, which essentially criminalizes the attempt to suicide, should not be made applicable in such situations. The other issue with the term committed is it's extremely stigmatizing. And what it essentially does is that it criminalizes the attempt to suicide, the act of suicide, which leads to further stigmatization and discrimination against people who have attempted suicide, and is also fairly a triggering point for them. The second point that we wanted to highlight, which really hasn't come up yet, is that the subheading of the article, if you have a look at it, very clearly focuses on the celebrity's contribution to society. So as you can see, this report is about the death of Sushant Singh Rajput. And usually when it comes to celebrity suicides, there is a tendency to sensationalize and glamorize suicides. Whereas what guidelines usually posit is that in case of celebrity suicides, it's very important to focus on what the celebrity's contribution to society has been. And this is simply because of the fact that celebrities are seen as role models in society, and they have an extreme sort of influence on the masses. And hence it's important to project information about celebrities in a more positive light. And hence, whenever you are speaking about or reporting about a celebrity suicide, do make sure that you are highlighting the contribution of the person and their work and their positive legacy. We will focus more on celebrity suicides in the subsequent slides, so don't worry about that. The third point is that yes, this article, like Priya pointed out, provides information about support resources. I think this is extremely important, and as you saw, when we began this workshop itself, we put out a trigger warning, and we also put out a helpline in case people would be triggered and would want to reach out to it. I think any report which on suicide must necessarily contain a trigger warning and contact details for a helpline or mental health professionals or emergency services where they can reach out for support. And the rationale behind this is simply this, that reports on suicide are usually very triggering for the most quote unquote healthy people, right? So any person who is reading a suicide report can be very severely triggered, and they might need psychological first aid or counseling in that moment. And hence, it is ethically responsible to provide details of a suicide helpline or a mental health professional or an emergency service. The other bit, again, very important, is if you can see on the right column of the report, the report actually quotes two tweets. One is by Soumitra himself, and one is by Milind Deora. The report by the tweet which has been referred to by Soumitra essentially talks about reporting guidelines on media and myths around suicide and suicide prevention, whereas the tweet on Milind Deora by Milind Deora essentially refers to his tweet where he himself came out and spoke about his own experience of mental health, and also where he suggests 4 or 5 effective coping tools. Now, this is great practice. So essentially, you would, in terms of a guideline, you would want to say that any suicide report should consult a mental health professional, or should refer to a mental health professional or a research study, and at the same time destigmatize it, right? So the tweet by Milind Deora essentially destigmatizes suicide because it's a celebrity, it's a very influential person who's actually openly talking about their experience of mental distress and suicidal ideation, and is also putting out coping strategies. So this is also a very, very important guideline that one must follow. And the last bit, which you've all very correctly sort of brought to our attention, is that the entire report destigmatizes help-seeking behavior. If you see the disclaimer and the trigger warning, it says, if you feel suicidal or know someone in distress, please reach out to them with kindness, right? And call them and call these numbers of local emergency services, helplines, and mental health NGOs. So I think what the entire article, and especially this disclaimer, along with the tweets that have been referred to, is that they're destigmatizing help-seeking behavior, right? And that's something which is really, really essential, given the fact that there is so much of silence, collective silence, and a taboo around reaching out for support or reaching out to others to provide support, right? So this in many ways destigmatizes help-seeking behavior, which is really crucial when you're reporting suicides. Okay, so let's, if you have any questions, please put them down here. We will get back to them, we assure you. Let's move on to the second exercise. Jasmine, could you? Right, so we're again going to share a screenshot of another published article. And what we'd like you to do this time is to list 3 aspects of the article that you think negatively report suicide, right? So in other terms, these are bad practices, or they are violating suicide reporting guidelines, or they're portraying suicide in a very negative manner. So yeah, so we'll just put up the screenshot, take 2 minutes, and please put your answers in the chat box. Okay, another 45 seconds, and then we'll start discussing the article. Okay, so I'm going to start reading some of the responses. Okay, so let's begin with Siva, who says 17th floor, which basically translates to identifying the location and the method of suicide. Guna says that the term depressed is judgmental and it starts at the article. That's very true. Malika again refers to the phrase commit suicide. Also that the article mentions method, which has also been reiterated by Kunika. Nagarjuna raises an important point that there is no need of a picture. Sanmati raises points like many others have about the details of the act, reason for the act, usage of the word committed. Savari said that graphic details have been provided. Medical Macaroni, you've also raised points about details of the suicide, name of the address named, very important, assumptions made about the causes of depression, literal address provided leading to stigmatization of those who live there, and the family name mentioned. Fabulous. Soumitra has again raised the point about stigmatizing depression. Mehreen has talked about negative headlines, including trigger hooks, which Shraddha has also mentioned. Okay, Priya, you mentioned there's a triggering image. There's detailed description of the method, which a lot of you have raised the point. Nagarjuna have raised an important point that the 17th floor is actually glorifying suicide. That's very interesting. Malika, you said that black image of a woman adds to the stigma. Okay, that's also very, very interesting. So that raises questions about what kind of images and representation are actually safe or not. Soumitra raises an important point that the other article, that link is a murder. Okay, so very interesting. Putting in a link, a link around a murder report with suicide. No contact numbers to prevent suicide. That's Siva. Savari raises the point of mental illness speculation. Professional stigma could be triggered. Meera raises the point, she raises the use of the word perished. Why use the word perished? Absolutely. Anushka also says that this is gender biased. Okay, that's also a very interesting point. Okay, so these are some really interesting responses. Thank you so much for putting these in, and a lot of these are extremely valid. Jasmine, could you move on to the next slide? Okay, so as all of you have very rightfully mentioned, the headline, first of all, is extremely sensationalized. It uses the word depressed. It uses the word commits. It does multiple things. It identifies a single reason of suicide, which says depressed due to present lockdown. It details the method of suicide. So this is a really terrible example of a suicide report, and it practically sort of checks all the bad practices and flouts most guidelines. Okay, so let me just sort of elaborate a little more on each of these guidelines. The first guideline, which says it uses vocabulary that criminalizes suicide. We discussed this a little bit in the previous exercise, but I just want to sort of raise this point a little, sort of emphasize on it, because often many journalists and others don't really understand the importance of language. And this is just not limited to the use of the word committed, but it also extends to other phrases which are commonly used. So, for example, there is this tendency to present suicide as a desired outcome, right? So a very problematic phrase which often used is successful suicide. So if a person has died by suicide, it means it's a successful suicide, right? Now that's a really problematic phrase. What you instead want to say is that a person has either died by suicide, or they've ended their own life, or they've taken their own life. Another common example of sensationalizing suicide and the use of language to sensationalize it is using the phrase suicide epidemic, right? Very often you might find reports which will refer to a suicide epidemic because there have been so many suicides that have happened in a particular year or a period of time. Now that again is a very problematic phrase, because you're essentially sensationalizing it, you're glamorizing it. Instead, you would want to use more appropriate phrases such as increasing rates of suicide, or higher rates of suicide, or a concerning increase, or a concerning concerning rates of suicide, right? Which basically indicate that suicide rates have been increasing, but you're desisting from using more problematic and sensational sort of phrases like suicide epidemic. Another sort of common phrase which is used, especially when people might attempt suicide and they don't die by suicide, is using the term failed suicide, right? As if, not dying by suicide is considered a failure, right? Now, this is again a problematic phrase which is often used to glamorize suicide or to kind of portray it in a negative light. And an appropriate phrase, instead of, say, using failed suicide, would be to say a person made an attempt on their life, or they attempted suicide, right? Which is enough to say that they survived. The other problem with this article, like all of you have pointed out very rightfully, is that it sort of, some of you have pointed out, is that it reduces this suicide to one factor, that is the person was depressed during lockdown. And I think it's very important to understand, and as Soumitra mentioned in the previous slides, that there is never one cause for suicide. There might be triggering causes, but there's never one cause. For a person to have to attempt suicide and then die by suicide, there are a multiplicity of factors and causes which have to fail. Right? There are multiple things which have to go wrong at different levels, whether it's the individual, the community, societal, or the interpersonal level. So to reduce a person's suicide or their attempt to a single factor, such as in this case, depressed due to the present lockdown, is not just unethical, but it is a completely unscientific and a wrong way of representing suicide. The other thing that many of you have mentioned, is that this report gives the exact details of the location, where they've mentioned the floor, the 17th floor, and they've mentioned the address of the person where the person was staying. I mean, this is terrible. I mean, you simply should not be disclosing details of a location, because what it can also do, especially where people have attempted suicide in public locations, for example, a bridge. Now, a bridge is a very common location from where people attempt suicide. So if you use the term bridge and give details about what bridge and where the bridge is located, that can actually give people ideas, and can also kind of then encourage that location as a suicide hotspot where multiple people will then go and attempt suicide. So never ever give details of the location, never give the details of the method, because then again that gives ideas to people in terms of how they can attempt suicide. Often what people do is that, say, if a person has attempted suicide by consuming certain drugs or certain pills, there are some reports which will go to the extent of describing what these pills are, right, and give the exact chemical and the constitution and all of that. And that's again very dangerous, because you are essentially giving out triggering information to people, and possibly encouraging them to try that attempt. Apart from that, like you've already mentioned, no information about support resources have been given. And finally, this article also provides a link to other potentially triggering articles. Like someone raised the point that this article actually, it signposts you to another article which reports a murder, possibly, and you can just imagine what that does for the person who's reading the suicide report, because it's essentially equating a suicide attempt to a murder case. So not just that, even if the article is signposting you to other triggering articles, say, of other suicide reports, that is equally problematic. And it's best that we desist from hyperlinking any triggering material, and instead replace any hyperlinks with positive material, whether it's in terms of hopeful stories or links to or contact details of mental health professionals, or emergency services or helplines. So yeah, I think I'm going to end this exercise here and hand it over to Jasmine. In case you have any questions, please put it down and we will get back to you. Thank you.
So what we're going to do in the next section is actually move into keeping the spirit in mind of practicing some of these guidelines and seeing how it applies in our day-to-day realities. We will try and implement some of the guidelines that we've been discussing so far. And we will do this through 2 case studies. The first one will be where you will have to actually do some set of exercises of thinking of the headlines and questions, and then we will link you to the relevant guidelines and the best practices that are available. And then we will move into the 4th exercise, and that will be the end of the activity bit. So we do understand that while we are aware of what are best practices, there is often a challenge in using those best practices in our day-to-day reporting. And sometimes the challenge might be that we perhaps don't have the language to change and to make this paradigm shift from the usual way in which we have been reporting. So the exercise is an attempt to start articulating some of our different thoughts, the way we could be addressing some of these guidelines in our respective fields and wherever you might be based, whether that's print or digital media. So what I'm going to do is the screen has a situation that has been presented to you, that you've received news that a 34-year-old daily wage laborer in Noida, who was in quarantine while his COVID-19 test results were awaited, has died by suicide by hanging. He's survived by his wife, a 4-year-old son, and aging parents. So this is the information that you have with you. And what we would want you to do, spend the next 5 minutes, is draft the headline of how you would report this. We also want you to think of what would be the subheading or the byline. The second thing we want you to do is, would you interview someone for this story if you had to report it? Who would those people be, if you can list it out? The third part of the question is that in case you decide to interview a bereaved family member or a friend, what questions would you ask them? And we want you to list down 3 questions, if you can think of 3, or at least 1 question. So you have 5 minutes, and there is A, B, and C. You can begin, we'll follow the same format where you can use the chat box to write your responses. So I'm going to just give you 5 minutes.
Jasmine, they might need a little bit more time. Maybe you could even give 5-7 minutes. I think
So we'll,
because
right,
there's quite a bit of work to do, so it gives people time to think.
right. So we'll start with 5. If we get a request, then we
Sure.
can increase that. We can take 30 seconds to add in some of the responses. Okay, I think I'm just going to give you another 30 seconds. I feel like people are still writing in. I'd like you to be more specific about the questions that you would ask. I can see a few headlines and a few sub-headlines. Okay, so let's stop there and go over some of the responses that have come in. Okay, sorry, I'm just trying to scroll back. Okay, one of the headline suggestions is 34-year-old dies by suicide even before COVID result was declared. The subheading is he leaves behind wife, 4-year-old son, aging parents. Okay. Menaka suggests lack of psychological counseling in quarantine centers. Examine the conditions of quarantine homes. Speak to, okay, so people that you would interview is you would first go see what the quarantine facility looked like. In this case, it could be a home or a facility-based space. You could speak to the people who are there, doctors, psychologists, on importance of psychosocial counseling, as was done with HIV. Okay. Some of the questions would be, what did he say about the conditions of the quarantine home? Was he treated badly? Questions related to stigma. I suppose you're asking this from the person who's bereaved. Okay. Okay, this one is a good one. Medical Macaroni says, headline is laborer dies in COVID-19 quarantine. Subhead would be allegedly died by suicide while awaiting lab test results. Who you would speak to? Saying police, quarantine facility, staff, and family members. Where you've added some caution, where you're saying you would empathize with the family, try and understand if they're willing to talk, sit by their side, ask how they remember the deceased if that is not too triggering. Okay, so you're making a note about triggers. We'll also ask how I can help them, what do they expect in terms of support, and how the pandemic caused them anxiety or affected their livelihood. Okay, so to get more context-related information. There's more suggestions on people to be interviewed. Similar quarantine authorities, if in hospital, wife and 1 or 2 neighbors. Okay, any particular reason that would be interesting? Similar, you would speak to the doctor, neighbors, co-workers. Okay. There's more suggestions on, was the victim, did the victim had any history of depression? Okay. And how is the victim before going into quarantine? Has the COVID depressed him more than perhaps his earlier issues, if any? Okay, so we seem to be giving more emphasis to possible causes of mental health distress, but we're calling that depression here. Shobi writes, man awaiting COVID-19 test results dies by suicide. That's the headline. The byline is 34-year-old person was in quarantine and is a daily wage laborer. You would interview the wife, mental health expert, police, all right? And questions would be, did they show signs of distress or seek help earlier? Okay, Priyanka writes, laborer dies by suicide in Noida quarantine center. Quarantine center staff is someone that you would speak to, any medical professional, local police. That's been covered. You're raising the point if they would feel comfortable addressing the media and then perhaps restrict the question to getting background information to present a fuller picture of him as a person rather than a statistic. That's an important point. Harshal is, headline is 34-year-old daily wage laborer dies of suicide. Subheading is died while in quarantine and was tested for COVID-19. Results were awaited. He survived by wife, 4-year-old son, and aging parents. Okay. Similar people that have been covered. So I'm not gonna repeat that. Tanmay is saying, what would be the larger purpose of such reports? Do they serve to point out systemic issues that lead to avoidable deaths? So apart from simply aggregating facts from the suicide, are there ways in which we can tease out those psychosocial triggers with empathy and sensitivity? Okay, that's an important point. Nidhi is similar headline, 34-year-old wage laborer dies of suicide. COVID-19 test results were awaited. The person is survived by so-and-so. You would speak to the wife and police officials and you would take consent. Now that's interesting, that's come up. And would ask people to present the person and his beliefs. Okay, so more person-centric stories. Someone has said that they would like to interview the therapists who have worked on mental health issues. So essentially, I'm reading that as mental health care professionals. You've said, Merin says, young daily wage laborer dies by suicide. He was 34, sole learning member, survived by partner. All right. Vaibhav, you're saying you would like to ask the family about simple identifiable symptoms, lack of sleep, or change in behavior lately. So we're seeing a range here. I can, some of the good things that have come up is you've stated it very clearly without sensationalizing it, that this is the event that has occurred. A person has died by suicide. It's optional whether you would want to use the words by suicide or person who has who's killed themselves. So that has come up. In terms of the groups that you're saying, you've mentioned a large range and variety where you're not just looking at people who are bereaved, but also people in authority, people who are mental health care professionals, even the police is something that has come up. The good news is everyone's picking up on taking consent for taking interviews. If you need to speak to someone, And I think the interesting thing is, how do you show that you want to take consent? How do you show that you want to be empathetic? How much do you listen and how much do you just let people talk, especially at a time where you're speaking to a person who's grieving? So that seems to come up. I can see a few references here and there of linking it to their mental health condition. And I think the point that we've been trying to emphasize on is that there is no one cause of someone dying by suicide. So while you might want to get a sense of their mental health or how they were, that can't be the only reason that they might have died by suicide. So I would refrain from it a little bit. Is there, I hope I've covered everything. What I'm going to do is actually move into some of the relevant guidelines that might be useful for us to refer to. Okay, so if you see, what we've tried to do is put together some of the headlines that we commonly see, where people are giving the details of, say, their age, or using similar terminologies that we've already been discussing about committing suicide. The issue of the bridge has already been discussed, so I won't get into that. And the third one, again, similar issues that we have discussed about where exactly is it happening, and basically giving in details that perhaps are not really relevant to the story itself. So what sort of guidelines does one need to look at? The first thing is, of course, that don't sensationalize it. And I think some of your examples have done that. So it just shows that this is possible and we can do it. And you don't have to use a language that criminalizes the act of dying by suicide or the attempt itself. The guidelines also do recommend that consider that whether you need to use the word suicide at all. So that's something to keep in mind. And the third thing that we would want to highlight here is you don't want to make explicit references to the method. So I think that was one thing which was very positive, that no one wrote the method of this particular person who had died by suicide. So I can see that the language already, you can see that it's shifting. It's trying to do the opposite of what some of these examples are doing in front of you. Something else that you've already picked up on, and very well, is we have been saying that suicide is a complex public health issue and it's also a social issue. So while it is associated with mental health conditions, but I think that's what we covered right in the beginning, that it's only about 50% of cases, whereas in 50% it isn't. So I think we need to broaden the conversation. We need to bring in the complexity of writing about suicide. Just as there is a complexity of writing about life, where there's no certain linearity in the way we think or we act, in the same case where we're talking about writing about death, it is a slightly more complicated situation. And when you are trying to present that as a picture to someone who's reading an article or reading about someone's death, something that you've all picked up on is speaking to credible sources. So most of you have mentioned you would consult a mental health care professional. You would want to get an understanding of suicide or attempted suicide. It is an opportunity to educate people about the issue of suicide, given the stigma and given the lack of conversations that we have around suicide and suicide prevention. Writing about someone's death by suicide is an opportunity to explore, to expand the conversation, to change the narrative, and bring in certain voices that give us the complexity of the problem too. The second point that we had here was, Ken, I think some of you, by mentioning these different stakeholders, you also have gone back to who can give you verifiable information. So if you are quoting a research article, then go and try and find something that is evidence-based. So you might want to look at what the WHO is saying, or what the Lancet articles are. So finding enough credible sources that you could quote to increase the conversation around suicide. You've all picked up on this, that you would speak to a range of stakeholders and not just go to, say, like, the police and get the report and report it as like a criminal sort of an activity. You have brought in aspects of speaking to the enforcement of, say, the quarantine facility heads, or speaking to different hospital authorities, speaking to family members if they are consenting to do so. So the next section that we wanted to move out is actually picked up from a similar article that had been done, which is about a senior citizen's death by suicide, where the first section, they tried to speak to the police to get a sense of what they had said. I won't go into the details, but basically they first spoke to the police, but they actually got in different stakeholders. So they had a social media group, which this person who died by suicide is a part of, and they got their response of the death by suicide by emphasizing on, like someone had mentioned, a more person-centric story, which is to understand how does a senior citizen during this sort of a period of distress might feel lonely, and what is the relevance of these support groups, which might exist on a digital platform or maybe in-person platform, and how they're trying to work through this person's death by improving some of the services that they provide. So it also gives a more positive twist to the person's death. So I wanted to highlight that to say, what does this balancing of perspectives really mean in actual practice? So something
Jasmine, can I just add something to the previous thing before you go to the next exercise? You are moving to the next exercise, isn't it?
No, I'm still on the exercise, but please go ahead.
No, go ahead. Then when you finish, I'll just add at the end. No, go ahead. Sorry, I don't want to interrupt.
All right, I just have like a slide or so. I'll finish that and then you can come in. Okay, what we did want to emphasize in this particular section was speaking or interviewing people who might be grieving or have lost someone who was close to them. And I think these are obvious things that everyone is aware about and has come up in some of your suggestions that you've been doing. But we often see that these, basic understanding of privacy, consent, and confidentiality are often violated when we read some of these reports. So it's just to step back a little bit and reflect on, why do we need to do these interviews? How do we actually ensure that we are ensuring people's privacy or confidentiality? What are the words that we could show to actually articulate to show that we're there for them? So the first thing is to exercise care and caution while speaking to people who might be close to this person who's died of suicide. Research has shown that they might themselves be at an increased risk. They're undergoing a process of grief, and a death by suicide does leave a lot of unresolved questions. And there is a constant amount of perhaps guilt that they're feeling because of the death by suicide, and it comes in at a time where you might want to do their interview, but they're also at a very vulnerable position. So this is just to give caution to say that there are human beings behind this, and their ability to respond at that point in time needs to be respected. So if it is necessary, you might want to delay the interview if they feel that they're not ready for speaking about the incident. There is a suggestion to say you could take verbal consent, but you could also take written informed consent. And consent here, just to clarify, is the right to refuse to speak to you, and that needs to be respected. At all points in time, we need to ensure that you're not infringing on someone's privacy. If the person who has died by suicide or has attempted suicide, you don't want to be revealing names, photographs, personal details, which speaks to some of the earlier discussions that we've had. The guidelines also highlight that if you are aware of certain information about the person who's died by suicide, you should be a little cautious of publishing information that they might not be aware of. So, for example, if they are seeking certain healthcare facilities for their own healthcare or mental health care needs, that cannot be disclosed without their consent, and you need to be cautious by checking in with the person that you're interviewing. Some of the other suggestions have always been that how can you speak about stories of people who have been through the situation and have coped and have come out of it, or have a more positive story which can speak to certain coping strategies or provide stories of hope and reassurance. And that does come very crucially for people who might be grieving at that process. So it is important to think of what information could you leave with the person that you're interviewing. Where could they seek support? What sort of information might be helpful for them to understand more about mental health or suicide, or any other information that they might need access to and cannot access at that moment. And the last thing that is relevant to this discussion is also to focus on suicide prevention when we're talking about our reports on suicide. So you could ask questions, you could educate the public about dispelling myths, you could give coping strategies, you could promote health-seeking behavior as a way of then increasing that conversation and expanding that conversation from a very monocausal or a sensationalized sort of a discussion. Soumitra, you wanted to add something?
Yeah, thanks. Can you hear me, Jasmine?
Yes, I can.
Hello? Yeah. I just wanted to quickly dial back to what Tanmay said on the chat at some point. I think really the first question that you need to ask yourself is, why are you reporting this story? And you'd say, obviously, because there's a suicide. But that's not true, because in India, on a daily basis, about 300 people, or even more, probably 400 people will die by suicide. And on a daily basis, newspapers report about 10 to 20 suicides. So clearly the remaining 290 suicides are not being reported. So if you're reporting this particular story, what is the reason? I think you need to be asking yourself, why am I writing this story? The second point I wanted to make, and I think it's important that you decide why you're writing the story. What's the bigger purpose that you're serving? What's the public interest that you're probably trying to serve in this story? The second point I wanted to make was that, in a sense, people still jumped to two factors. One was either it's a quarantine related issue, or this person might have a mental health status of some kind. So there is, even without just saying it's depression or mental health, we do tend to jump to our own conclusions. And so I think it needs to be something that I would highlight there. And the third thing, I mean, somebody put here, Garima said here that by the very nature of death by suicide, we never know the reasons for it. And I think that's really the issue. We never really know the reasons for it. And so it's important that you think about that. And suicide prevention is something that could be brought even into your headline. You could even use the words, highlight the fact that there is a need for suicide prevention or something of that sort. And I think the body of the story, if this is a personal interest story, then you need to kind of actually make it more of a personal interest story. But also, I would really strongly urge you to use this as a way to encourage more discussion around suicides, and educating people what are the reasons of suicide, or what are the possible reasons. What could we be doing? It doesn't have to just end with just stating out the facts of the case. So I'm just going to Well, I'm before I stop, Padma brought it up that this has got to do with how news bureaus are set up with crime reporters having to churn out stories, and suicides often make a big chunk of this reporting. I totally agree with you. And when I recently raised this up publicly on Twitter, saying that one of the simplest things that media could do is to shift suicide reporting from crime reporters to health reporters. Many of the media people were not very happy about it and said, "Oh well, everyone should be good enough at it, and the crime reporters need to do it." But yeah, I mean, this is something I've heard repeatedly, that crime reporters are usually on the bottom of the rung in media houses, and they are the ones who are reporting the stories. Very often, it's a slow media day, and so you kind of say, "Oh, I better write about something," and so you have a suicide story to report. I'll stop here because I know we also have time issues, so I'm not going to go on and on.
I had a quick point, but I'll come in once we move on because we're short on time. But
Go ahead, Arjun. That's fine.
Yeah. No. Okay. Thanks, Jasmine. No, I just wanted to raise this important point. I think also what tends to happen, especially in the cases of celebrity suicides, is that there is a lot of conjecture and speculation around what was happening in the person's life. Why did they attempt suicide? I also saw in the comments somewhere here that someone had mentioned that they'd also make an attempt to find out what symptoms was the person going through. Now, I do feel that this does tend to lead to a lot of conjecture and speculation, and as we've already discussed, it's really never possible for us as either journalists or otherwise who are not closely associated with the person to ever find out what the complete set of causes were. And I do feel that kind of conjecture and speculation, especially around symptomology, around what was happening with the person, were they sleeping enough, were they on medication, XYZ, can be very, very damaging, not just because it can portray the person in a negative light, reveal very private details, but also be extremely inaccurate, unverifiable, and also possibly triggering for other people. So that's just a small point that I wanted to raise, that while we're reporting, we also don't want to fall into conjecture and speculation and get into details that we possibly will not be able to understand completely given our roles. Yeah, that's about it. Thanks.
Thanks. Okay, I know that we're short of time, but I think some of the issues that have been raised are perhaps only issues that we can raise and not find a complete resolution. But we have kept about half an hour in the end to discuss some of these issues, and I can see some very interesting responses that are coming up, and something that we would be interested in knowing more about. What are these real barriers that it really comes down to the barriers that we have to face while we're reporting these sort of stories. And if it was just a simple narrative shift, then it perhaps would have happened earlier, but it is a difficult process. It really requires a shift in the way that we have conceptualized what importance needs to be allocated to something while we're reporting suicide. And I know that just asking the right kind of questions can be a whole training in itself. And I know that we have limitations at this moment. So what I'm going to do is, given the time limit, I'm not actually going to go into the next exercise, as in, I don't think we'll have time to really go over some of the suggestions that you could have. I'm going to quickly run over some of the relevant guidelines. Some of this might have already been covered, so I'm just going to run over presentation. This is something that we have already discussed. Why we want to focus specifically on celebrity suicide is it has been brought up earlier to show the significance of how a celebrity's a death by suicide has huge implications, and therefore the implications of reporting it in a sensitive way and in a cautious way with best practices can lead to a reduction in further suicide. So these are some of the examples that you can see on your screen. A point that has been just made right now is do not speculate about the reasons for death by suicide if you do not know the reasons, and we know from experience that there is no one cause of dying by suicide. It needs to be clearly said so whenever we're writing about this. This is an example to show all sorts of conjectures that are made about whether it's financial crisis, whether it's a murder, whether it's depression, whether it's something else, and I think we need to draw caution to that. Something else that seems very obvious, but we know that has been violated just very recently, about not publishing suicide notes, texts, or posts that people have shared, or any other personal information, since you do not have consent to share that information. And I think we need to reflect on what authority do you come in with to violate someone's privacy. And is it even worth the agenda? Is it really worth reporting? Something else that we did want to highlight is just the very placement of these stories. The guidelines say that it should not be the headline. It shouldn't be the screaming words that you see just when you are referring to a newspaper or a magazine. Ideally, they say it should not be in the front pages, third pages, or on top of an inside page, or it shouldn't be a lead item. You can see some of the examples that are mentioned here, which are not abiding to those guidelines. And something that we just wanted to bring home is the fact that the Press Council of India does have guidelines. So it's not about guidelines that exist somewhere else, but it is in our very context. It is supposed to guide our practice and our behavior. Some of these have already been mentioned, is to say that to constantly question, do you need to publish stories about suicide prominently? Do you need to keep repeating such stories? What is the purpose that we're trying to solve here? This has been gone into slightly more detail, is to not use language that sensationalizes or normalizes suicide. Do not describe the method, do not describe the details of the site and location, do not sensationalize the headlines, do not use photographs, video footage, or social media links. And this is mentioned in the Press Council of India. So just trying to bring that home. I know that there are lots of interesting comments and suggestions in which we'll try and do over the discussion. And I'm just wondering if we have time to cover additional guidelines. Arjun, do you want to just briefly go over it?
Arjun, you're muted. Arjun, you're muted.
Sorry. No, I'm going to rush through the guidelines just to make a note that we've developed a small resource pack which has a copy of the reporting guidelines. So you will find all of this information in that. So in case I'm rushing through, please don't fret. You can always refer to that. And in case you have questions, you can always get back to us after the workshop. There are two important aspects in the additional guidelines that we'd like to address. The first is, of course, guidelines for reporting children's death by suicide. I think this is a really, really important aspect, given the fact that suicide rates between the ages of 15 to 30 are the highest in the country. Just to kind of clarify, given the fact that we live in India and the term child can have multiple connotations, by children here we specifically mean individuals who are below the ages of 18 years of age. Very quickly, just in terms of what guidelines you need to keep in mind is, one is avoid describing a suicide or a suicide attempt. And the rationale for this is that children are particularly vulnerable to what we call copycat or imitative suicides. Children have a tendency to imitate others or what they see or what they read. And hence it's important to completely avoid any kind of description of a suicide attempt. The second is Please avoid sharing graphic illustrations with suicide stories, especially illustrations which are in the nature of pictures, cartoons, which are often attractive to young children. And these can be particularly triggering for children. And also, if you are depicting representations of children who are experiencing mental health problems, then you want to think about how can you do it in a more positive manner rather than showing the children extremely distressed or despondent or sad or shedding tears, which can be possibly triggering for children. So you want to ensure that your representation and your illustrations have enough of positive content on it for children. Especially when it comes to children, avoid reporting suicide as a simple issue. This is something which we've seen very commonly, especially in cases of children who have died by suicide because of a reported failure in examinations. I think it's important to understand that failure in examinations itself is not a cause, a singular cause of suicide. There are, as we've mentioned, multiple concerns and multiple factors which are at play. Recently, of course, we've been hearing various reports of students who've died by suicide because they've not had access to online training, or they can't access their online classes, or so and so. And reports have they've kind of very openly said that these children were suffering from depression, and hence they required mental health counseling. I think these are very reductive and simplistic explanations of suicide amongst children and adolescents, and I think one has to look at it in a more complex manner. So avoid simple cause and effect relationships such as failure in examination, hence that's the reason for the child's suicide. So maintain the complexity when you're reporting it. Do not romanticize suicides. So don't use phrases like a life cut short at a tender age, a life tragically cut short in full bloom. These are phrases which have actually been used, and this unnecessarily brings attention to the age of the child. So you want to ensure that again your language is extremely simple and is not romanticizing or glamorizing suicides. And lastly, of course, please do provide helpline numbers for childline services. That's extremely crucial as well, especially services which are sort of more, which are friendly, more affirmative for adolescents and children, which they might be more comfortable reaching out to. And similarly, any other resource that you share, please do ensure that it is affirmative for adolescents and more suited for them. Just to go back on the point about, avoid reporting suicides as a simple issue. This is something which has often happened, especially in the cases of suicides where people belonging to Dalit communities have attempted or died by suicide, especially in educational institutions. And time and again, explanations and reporting has often put the burden on the person to say that this person was suffering from depression or mental health issues. I think it's very important to understand that when you're reporting suicide of people who belong to marginalized communities, to really identify and highlight and foreground the systemic issues of discrimination which are a result or which cause the kind of distress that might lead a person to suicide. So please, avoid identifying singular factors such as depression. Especially, I mean, this is for any kind of a suicide, but there's a particular trend when it comes to people from marginalized communities to simply say, oh, they were depressed. It had nothing to do with the institutional discrimination that they were experiencing or the societal or systemic discrimination that they were experiencing. Can you move on to the next slide? Thanks. Okay, so very quickly, guidelines for reporting suicide on digital media platforms. The WHO has also come out with guidelines specifically for digital media platforms, and also because this is a more recent phenomenon, there is a lot of evolving research in this area. Of course, there is a whole body of research which is now increasingly reflecting the impact of social media on mental health issues. But if we just look at how do we, what do we keep in mind while reporting suicide on digital media platforms? One is something that we've already discussed previously, is to avoid hyperlinking negative suicidal material on the website or on social media. I think where there are platforms where you can moderate content, for example, if there are fora or forums where people are putting in comments, I think it's important to moderate those websites and ensure that there is no triggering content on it. And whoever's administrating those websites should be able to in a sense, remove that triggering content. As we've mentioned, provide information and resources. That's something which is, I mean, this is a universal guideline for all kinds of reporting. If possible, provide emergency, links or buttons which can directly connect a person who is in crisis to a mental health professional or a helpline. Often that can be a very helpful feature, especially in a crisis moment where a person is at an imminent risk of attempting suicide. And I think most importantly, because social media is a bit of a loose space, it's a bit of a difficult monster to contain. I think it's important to have regular workshops with websites, content managers, organizations in general, to keep sort of reinforcing the need to implement good practices, best practices for reporting suicide prevention. So from your end, if you are working with social media organizations, then please do, or digital media platforms, please do continuously do your advocacy and increase awareness around these issues. Very quickly, so how do you, of course, provide support to media professionals? Let's address the elephant in the room. I think, I'm sure people working in journalism are extremely stressed. It is a high performing, high pressure, high stress kind of a vocation. And I think at the same time, it's really important, while we're talking about, guidelines for reporting suicide, to also ensure that there are enough support and care measures for media professionals who might be experiencing distress while reporting suicide, because it is a very triggering and distressing experience to be doing that. And I think organizations need to be at the forefront and need to be really proactive to enable channels of support, whether it's giving referral links to mental health professionals, support groups, mentors. I think that's really important to have mentoring staff who can really handhold reporters, especially young reporters. Ensure that you have a culture of briefing and debriefing while reporting on suicide deaths regularly. I think that's important. And also if reporters have unanswered questions or they've been triggered, then these sessions can be very helpful to address some of those factors. Please do maintain regular contact with your staff and your colleagues while they're reporting suicide. It's just important to give them that emotional support, and also support around leadership and development, which is something which I'm sure organizations are looking into, and of course looking into self-care and practicing stress reduction techniques. These are things that we're happy to provide more input on at a later time after this workshop. Next. Okay, and finally, so I think Priya had raised initially a comment on so why is it important for media professionals to be adhering to these guidelines strictly? I think the answer is pretty simple. The research in that sense has been quite conclusive to say that the media plays an extremely important role as a protective factor, as well as a risk factor. So bad reporting is a risk factor, which could lead to an increased rate in suicides. Good reporting, responsible reporting, positive reporting is a protective factor, which could actually encourage help-seeking behavior. Responsible reporting, increase awareness around suicide prevention. It can dispel myths about suicide. It can share stories of hope and of individuals overcoming their suicidal thinking, and it can disseminate coping strategies. So I think in that sense, the media has an enormous role as a protective factor to prevent suicides. So I think looking at these guidelines is not just guidelines as something which is ethical and required to be done, but as something which has a very tangible effect on people and how they internalize and process stories around suicide. The media has a phenomenal role to play in that. So I think, yeah, that's a quick summary of why positive and responsible reporting is a protective factor. Thanks.
Thanks, Arjun. Tanmay, I will close with your final statements. You're on mute.
Sorry about that. I was having a chat this morning with a colleague, and what we arrived at was that, you know, for decades we've had this idea of human interest stories in newsrooms, and we finally come to a point in time where I think that label has become redundant. There are no specific human interest stories any longer, especially as the pandemic has shown. It's human interest cuts across every beat in journalism, whether it is business or healthcare or agriculture. I don't think there is room to sort of silo out human interest as a specific sort of softer beat, part of Sunday features, fillers. I think that idea is dead. Jasmine, if you could move on. So this has been my biggest takeaway, that when we start engaging with the idea of responsible reporting of suicides, that is probably an entry point into something much more meaningful. And it's basically, it basically teaches us how not to be insensitive while reporting any story. And this was sort of like a light bulb moment for me, because we tend to think of these things in isolation. Okay, this is a suicide reporting workshop, but it isn't really. It is, if we follow these norms, they just help us become more empathetic writers, no matter what our beat and affiliation is. And like I said, because the human being is really going to be increasingly at the center of all kinds of stories, if we internalize some of these norms of being respectful and dignified and lowering the noise, it's just going to help us become better at what we do. I think, very important to remember that our audience is on edge today. The people who consume news, people who who are browsing through stories. We are living at a period of unprecedented anxiety levels, and so we've got to be very mindful and very responsible about the way we do these stories. And I think a very important point, in addition to what Arjun said already about those of us who practice our craft in digital newsrooms, is to really take personal responsibility. I was mentioning this in the chat as well. I always tend to think of it as, I compare this with a piece of advice that is given to people who learn how to drive in India, that just assume that everybody else is careless. Don't leave the job of ticking all the boxes to an editor or a sub or somebody else on the desk. And this is, why this is so important is that on the internet, we have this thing called iterative journalism or iterative reporting, which is basically a fancy name for report first and correct later. This is a very, very destructive trend, and I think we need to be very wary, because, once something is out there, it'll be screen grabbed, circulated, as happened with Sushant Singh's case, for instance, where photographs of his body were being circulated on WhatsApp groups and Twitter, and personally somebody sent those pictures to me, and I reported the tweets immediately, but I couldn't sleep for a couple of nights, and although those tweets were taken down later, the damage was done, really. So this idea of reporting first, correcting later, let's just put this out and then we will see if somebody raises a stink. I think we need to be very, very wary of that. Next slide, please. Yeah, I do want to end on yeah, this idea of the diminishing marginal utility of every additional point of fact. You know, is every incremental piece of detail on a suicide really adding any value to the reader? If not, can we keep it concise? Can we focus on the life and the achievements of the person rather than, you know, and this has been spoken about many times already during this workshop, so I will not repeat this. And you know, very, very important to subject ourselves to the same principle that a lot of medical professionals follow, which is first do no harm. I mean, you know, this is sort of a golden rule when it comes to human interest reporting. And finally, what we've seen, I think Dr. Pathare was mentioning this in the chat, that because of the relentless work of suicide prevention advocates such as himself, this time we've seen something really, really remarkable, which is big mainstream media houses taking down stories. 2 years ago, when some of us started doing this, we would tag reporters and editors, and we would be met with the chirping of crickets. No one would even bother responding. About a year ago, some people started responding, and they would change the headline or they would take down a problematic graphic. But this time what we've seen is that this movement has become really broad-based. A lot of non-experts have joined in. A lot of people who have no prior affiliation with the suicide prevention movement or with mental health have joined in. And that sort of collective pressure has yielded tremendous results. And we have this screen grab of what Kalinga TV said. I mean, a proper, you know, a large television channel coming to Twitter and saying, we've not done this right, we will do better, is historic. And I think we need to take a moment and sort of congratulate ourselves as a community, because I'm very, very hopeful that we are actually getting better. But that also means that, you know, a lot of people, a lot of mistakes will be pointed out going forward. People will reach out to us on Twitter or wherever and start calling out the mistakes that we will invariably make. And it is all right to make those mistakes. But I think it's very important to be also very earnest and honest when we make those mistakes. So if we have to take down a problematic story or modify facts, you know, and we carry like a corrigendum or a correction line, it's better to leave like a 404 page than to say something like, you know, we've taken down the story because of incorrect facts, while the real reason you took down that story was because the language was insensitive. So, you know, the struggle to win back public trust that all of us in journalism are part of, I think these little gestures make a huge difference. So we have to go the whole hog. That's what I've learned. We can't do this by halfway sort of measures, half measures. And we are, I think, at the cusp of something very, very meaningful and significant. If what we have seen over the past 2 or 3 weeks is anything to go by, we are getting better. We still have a long way to go, but I think we need to also sort of take a step back and appreciate what we have already achieved. Media is talking about these things. Stories are being written dissecting, you know, media coverage, and not just on sites like News Laundry, which are in the business of dissecting the media, but general mainstream sort of portals, etc., are writing about this increasingly. And that is just a very, very positive and helpful trend. So yeah, on that note, thanks everybody. I'll hand back the mic to Jasmine.
Thanks, Tanmay. We actually wanted to end this by, first of all, opening up to questions that you had, but I suppose while we were also preparing this, there were a lot of other things that we think are equally important, and some of those we briefly touched about is what happens to mental health of journalists themselves. What are these barriers that we need to really look at and address very specifically, of, you know, what stops us from reporting suicide in the most in following the best practices. So, and I think that needs a far more discussion. This is just to open it up and raise some of these points, but it does need a more close examination. I know some of you have been asking about how does one change the narrative? How does one bring in structural barriers, for example, or structural bases of discrimination that might have an impact on suicide? So what are we doing about the training? Is there something more that we need to do? How do we build a more harmonious relationship with evidence-based research and reporting? And any other suggestions that you might have, and if we need to revisit some of these issues. So just, I suppose the presentation will be shared with you. We just wanted to list down what Spirit is, and I know everyone's been reading it, but we haven't quite discussed what Spirit intervention is. So some of the information will be in the slides itself, and this is where you can reach us for further information. And we did want to say that there's, again, want to highlight that if you are feeling distressed, then there is a helpline that you can reach out to. And with that, I was hoping to get into the discussion and leave the floor open.